Good morning, Tri-Cities. This is Karl Dye from TRIDEC, talking to you live from my house. This morning, we've got a great panel of guests from Benton-Franklin Health District. I'd like to take a minute and introduce Jason Zaccaria and Rick Dawson from the Benton-Franklin Health District. Good morning.
Good morning.
Thanks for taking some time out of your busy schedule. We know, we publicly or collectively probably don't know how busy you guys are, but maybe that's one of the things we'll talk about today. Appreciate your time joining us. We always start off Coffee with Karl talking about coffee or coffee mugs, and I've got this one. I'll kick us off. It's got a T. My wife's name is Tiffany. Yesterday was our 15th wedding anniversary, so I'm excited to be drinking coffee out of her cup to signify that our wedding anniversary yesterday. So you guys have a coffee story or a coffee cup you'd like to talk about?
Well, I have a stainless steel coffee mug that's designed to keep it warm, and the sad part is that it's now empty. Started out here at 6 o'clock this morning, and unfortunately my coffee is gone, and I'm only allowed 1 cup a day, so that's it.
And truth be told, there actually is more coffee in the other room, but Rick's probably had his allotment for today. So, I have my trusty blue solid mug here, and it's travel worthy and it keeps things warm, and so this is what I use when we're a road warrior. Otherwise, we're like you, Karl, with the traditional mug. So
that's great.
And actually, you talked a little bit about where you're coming from. You're coming from your home. Jason and I are coming from the Franklin County Emergency Coordination Center, as we are, or at least our command of operations for this response is co-located with both Franklin County and Benton County Emergency Management.
That's perfect. Thank you. I do need to clarify. I think earlier I said I mispronounced Benton-Franklin Health District. I want to remind everybody that that's where we are. I think just my own background, a long time ago, back in Idaho, I was a county commissioner, and we were in Bonner County. And I think that, the excitement of getting started here, I probably just reverted back to that. I did serve on the local health district board, and so I was lucky to learn a little bit about health districts, but maybe that's a good segue into opening off. Can you guys talk a little bit about the role traditionally, outside of a epidemic or pandemic situation of the health district? Like what does the health district do? And maybe like how you're funded, are you a state agency, or what's that look like?
Yeah, no, that's a great intro there, Karl, and thanks for that. The health district has been around for a very, very long time, I think, as our community knows. We have been a mainstay for public health. We work very closely with the State Department of Health, and in terms of our structure, we do have basically 3 different divisions or branches, as we like to call them here at the health district. The first is our surveillance and investigation, which deals with water and sewer and restaurants and stores and so forth. And then we also have another branch that we call our Healthy People and Communities branch, which is typically what people think of there is all of the nursing-related activities that occur, which is a little different than our surveillance and investigation branch. And then lastly, we have our administration branch, which is here fundamentally to support the other 2 branches. So if we think about it, the old school triangle of administration being on top, I made that perfectly clear when I came aboard almost 10 years ago that actually no administration on that triangle is at the bottom, and we're here to support the other 2 divisions for the boots on the ground. In terms of funding, we are primarily funded through state grants and some federal pass-through grants. We also do some fee-for-service type services, which you might expect. For example, there's very many that we do there. We won't go into that. I don't want to take the time. And our funding, our budget is approximately $11 million a year. So, we're not a huge organization in terms of funding, and we do have about 90 or 95 employees at any one time. So when it comes to COVID-19, we're extremely busy with a relatively few amount of people, particularly given our overall total population of the greater Tri-Cities area, which has really been a significant change for us. I think when COVID first started for us a little over 100 days ago, we were scratching our heads going, okay, here we go. This is another public health related activity that we are going to have to certainly be a leader in. But at that time, we also realized, particularly over the forthcoming weeks that kind of pursued after that, that we're not in this alone. We are going to need our business community and our other leaders to help us to basically combat and provide a response to this outbreak.
That's great.
Rick, I don't know if you got anything you want to add to that, but
I think for just kind of the public, the people that are out there, when you think of public health, most people think that we do immunizations. And that's, when I first asked, is what do you think the health department does? Well, you guys give shots. And I really like to point out that when we talk about those 95 staff members, we have one staff member whose primary job is to give immunizations. So the rest of those people do a myriad of things. And I like to always talk about surveillance and investigation because that's my world, which is your restaurant, your guys that are out inspecting restaurants, that are doing sewage system and water system work and inspecting your public swimming pools, doing some emergency preparedness work. And most related specifically to COVID-19 are our communicable disease folks that, in a normal case, we have about 4 people who are designated and dedicated to doing communicable disease investigation in our agency. So this is not, we talk about investigating disease, it's not anything new. This is what we do on a daily basis and do well. In some of our other programs, so I don't want to get, we call it HPNC. I don't want to say that we don't, because we do some wonderful work there too. That is our WIC program. So women, infant, and children, providing nutritional support and education to families. We also have a nurse-family partnership that is one of those evidence-based programs that helps teen mothers and families effectively parent children so that they don't end up in our criminal justice system. And over the years, they've studied this enough that it actually works. So we do some of that. We do some fatherhood initiatives. We do tobacco work, all sorts of things that you don't necessarily think about and you don't necessarily see. And that is one of the things for public health, that we do our work almost always in the background, that we have great accomplishments over the last 100 years of making sure, every time we turn on a faucet in the United States, we expect that we can drink that water and that it's safe to drink. And that's public health. We flush our toilets. We know that that's safely being managed. That's public health. We know that all of our kids are getting immunized or have the opportunity for that. And that, again, it's public health. So all of those things that you don't necessarily think about, we take for granted, are public health. So this situation puts us in a different light where we are stepping kind of out of the shadows and working to lead our community. And that is a different role for a lot of us. And, for me, Jason talks about 10 years. I've been with the Benton-Franklin Health District for a little over 33 years and, make very clear, this is my life's work. It's what I want to do, and I'm glad that we're doing it.
Yeah, no, that's a good point.
That's great. And governance, so just, for clarification, do you guys have like a governing board that's local leadership and, decision-making, basically, and I won't jump ahead, but I'll let you guys explain how that works.
Well, Carl, a little bit like you, yes, we do have 6 county commissioners. We have 3 county commissioners from each county. One is chair, one is vice chair. There's a rotation. They are a very good board. I think they have intentions of continually trying to help us in any ways that they can. When we think about funding is always tight. They do make a local contribution. Although small, it is still helpful. And we realize that the counties obviously have expenses that they have to pay for as well. So, but we do appreciate our board.
That's great. just a quick housekeeping message for the audience out there. We do have the question and answer function enabled on Zoom. So if you have a question, you can look at the bottom of your screen, hit the question and answer box, and we'll go through those as we get them. If you're on Facebook Live, also have the ability to ask a question through Facebook Live. For those in our audience that are asking about closed captioning, we're not able to do that on the live broadcast, but once we put it up on Facebook with the recording, we will have all the captions available. So we did want to make that clarification and make that as interactive as possible. So within your normal role, and then maybe we'll get into more of the COVID stuff, planning for pandemics or epidemics, is that, it sounds like it is, that's part of what you guys, part of your normal functions, sort of like sand table, just like all emergency management functions do. Is that part of what you do, and how does that look, and how did it transition into actually going into this 100 days ago, like you're talking about?
So we do plan. We have folks that work in emergency preparedness, so we have basic plans for operations. And much like a lot of programs and functions, the number of staff have decreased over the last few years as funding has changed and focus has changed. So 3 years ago, you would have found Benton-Franklin Health leading a regional healthcare coalition, but as funding has changed, our regional healthcare coalition grew to include all of Eastern Washington and is now managed out of Spokane, which is, and it works fine, but it's how do we get those resources, and how do we utilize resources across public health and our healthcare system to be prepared to handle surge, to handle changes in volume. And we do, for planning for our staff, we train all of our staff on an annual basis in emergency preparedness. We train them in basically incident command operations so that they're adaptable to changing operations and quickly changing structure to where your management is a little bit different and your boss may be somebody new today.
Yeah, and I think in addition to what Rick mentioned there's the communicable disease area of Benton-Franklin Health District that is really the boots on the ground, trying to get firsthand knowledge as quickly as possible when an outbreak such as COVID-19 occurs. This is not the first type of outbreak for Benton-Franklin Health District. We've dealt with SARS, we've dealt with MERS, we've dealt with H1N1, and fundamentally the tenets of public health and our response to an outbreak do not really change. Yes, the disease may be unique. There may be differences in the prevalence and deadliness of a disease, so to speak, but that doesn't change the way public health approaches these types of issues. And we come forward with proven scientific knowledge over decades of experience when we approach these types of things, and I think we've done the same here.
That's great. So I don't want to spend too much time on it, but that brings up a great question. Jason, you talk about that we have experienced these outbreaks before, and could one of you guys just quickly characterize the difference in between the COVID virus and, like you said, the SARS and the MERS and the H1N1, and what makes it different, from a disease standpoint, and then the governor's order, obviously, to close down, but maybe just clarification, and then maybe that'll lead to some more questions for us.
I think probably the biggest difference is the speed with which this has happened. When you look at a flu season or even H1N1 was the most, recent one that really affected us locally, that it was a slow moving response, that we ended up with, I think, about 12,000 deaths in the United States from H1N1, but that was over the course of 12 months. We're currently in the United States, over the last 120 days, we have over 80,000 people who've died from COVID-19. So that is, one of the big differences is the speed with which it's crossed our country and the severe impact that it's had, on our vulnerable populations, more than anything, and how much effort and time that it's taken trying to protect those folks, and in turn, trying to protect the medical system from being overwhelmed so we're not doing crisis standards of care, and protecting the community so that the community can be safe, functional, and prepared for recovery from this.
That's great. Let's jump right into the COVID situation. So can you guys talk a little bit about maybe how in this 100-day period you've changed some of your workloads, and really what are the main things that the health district's focused on right now to, I'm assuming here, and you guys can correct me if I'm wrong, but to contain the virus, to just like you said, make sure that the healthcare system doesn't get overwhelmed. Some of the vulnerable populations, like senior nursing facilities and ones like that. But can you talk a little bit overall about what are you focused on right now, and then we'll get into some of these great questions that we've got coming up in the queue.
Yeah, Carl, that's a great question. I think when we first started, again, it was slow. It's a novel coronavirus, and we did not know what we should have known early on. And it's no fault of ours or anyone else's, but when you don't know about something in terms of it being a novel coronavirus, in this case, things get a little tricky. As we've stated before, a lot of our normal and usual customary scope of work changed slowly over time, but that time frame was fairly short, in essence, a number of weeks. We quickly found that we needed some assistance, and so we brought in an incident management team. I think a lot of the members of the community are aware that we brought them in. They helped get us structured and a little bit better than where we were before, and also helped us with efficiencies, which was very helpful. We then transitioned them out and started working with our local county emergency management systems. They have been fantastic to work with, and really, I think, one of the biggest challenges for the health district is the ever-changing landscape of this virus. In terms, it's literally changing by the hour in terms of the amount of knowledge that we can gain from past experience, not only here, but elsewhere throughout the country. And I think, as we've seen, there's been a tiered approach in terms of response. So in no particular order of importance, but we obviously have a significant level of effort that's happening at the federal level, right? And we've seen Dr. Fauci, we've seen Dr. Birx, we've seen others, we've seen our president, all of that's happening. Then we have another tiered approach at the state level, which, and this is not just our state, it's all states, right? And similar to our Washington State Department of Health, there are similar other state health departments across the country. That's another level of intervention. Then we have our local health districts. In our case, we are a special district. We are local government, but classified as a special district. And so, working through all of these various levels of information and levels of effort that we're putting forward has, I think, been extremely helpful for all of us. And as we go through the process, we're getting smarter and smarter as we go. As we've seen, the governor has come out with the state Safe Start Washington, and BFHD has been very much trying to follow along with the categories there in terms of those indicators or metrics for a safe start of reopening. A lot of our effort as of recently has been working with hospitals and the coalition, as Mr. Dawson mentioned, in terms of healthcare system readiness, right? We don't want our healthcare system overloaded. And fortunately, up until this point locally here, we've been very, very fortunate in that our healthcare system has not been overloaded. In fact, there's been concern and discussion that people don't want to come into the hospital, and nor should they unless they really need to, but that there are opportunities where people are sick and are actually not coming to the hospitals. that is also a concern, right? There's that careful balance that needs to occur between if you're sick, you stay at home, you self-isolate, but if you're, quite sick, you need to get to the hospital. So that needs to happen. The other piece that we've really been focused on is supplies in terms of our personal protective equipment. Just recently this morning, I took a look out back at the loading dock here at Franklin County Emergency Management. They have a wonderful large platform with the capability for semis to bring truckloads in, whether it's coming through the Strategic National Stockpile, coming from elsewhere for proper distribution to the hospitals and other long-term care facilities and so forth that actually need those kinds of supplies. And then, so we've been focused very much on that. The testing is obviously continues to be an issue. We're focusing on that. Things are getting better and better. But I think one of the largest levels of effort that we're really focused on now is contact tracing. And that is, kind of all the rage at the moment in terms of how do we get a sufficient number of contact tracers here at the community to actually do the activities that they need to do to keep us safe.
Well, that's great. Well, yeah, Rick, do you have anything to add?
So, kind of talking about contact tracing, and that is, the original effort in this was monitoring, and actually we started with monitoring travelers coming back from China. Yeah. And monitoring them for 14 days after they came back and doing some of those things early on, keeping in mind that we didn't have our first case in Benton or Franklin counties until mid-March, and now at this point we're over 1,300, I believe. Yeah. We're close thereabouts. So, very, very quick ramp up to doing things, but really it's that investigation and contact tracing trying to, at this point, not control the spread, but to mitigate the spread, slow it down, try to keep people protected, give people the opportunity to protect themselves and their neighbors from the spread of COVID-19. And then that real focus that we've had from literally the first case we had is working with our assisted living, our active adult living communities, and our skilled nursing facilities to implement the right protective measures for those residents, as well as working with our emergency management partners here to make sure that they have adequate supplies of personal protective equipment for their staff, who are working in a very, very tough environment. And, we are seeing some success there. So I think it's really important to note that one of the places and where we saw this first was in, an adult living area, which puts our most vulnerable people at risk and at risk first. And we've done, and the facilities have done fantastic work at trying to protect those folks and getting there. And we, new directive came out a couple days ago that we need to make sure that we have tested all residents and staff associated with adult living and skilled nursing facilities. And, very proud to announce that Benton-Franklin Health in our community is about halfway there already. So we think we'll get the rest of it done pretty quickly.
That's great. I wanted to say two things here. First of all, acknowledge you guys for maintaining social distancing within the conference room there. I think that's great. Providing the model for everybody that's out there. And then also, I think especially the folks that are on the front line of this, from the nurses and healthcare professionals that are both in hospitals and the nursing facilities that you talk about, we all see stuff when we talk about them being heroes, but I can't imagine what it's like to go to work every day knowing that, there is this increased risk, and kind of do your job in a different fashion, wearing PPE where in the past you didn't, and then, kind of always having that unknown near risk. So I wanted to give kind of a shout out to the front line and the heroes that are really working on this. So maybe delve a little bit more into both testing and then the contact tracing, like how does it work? But let's start off with testing and maybe look at clarifying the tests that say, do you have COVID versus maybe like antibody tests, and how does that all work out? And then maybe if we could talk about where are we at currently for testing, who's, you talked about kind of the community that is at higher risk that we're trying to get to 100% of testing and the folks that support them. But then for the general population, what should people think about on looking to get a test? And then in the future, how's that testing protocol maybe going to change? And what do you see coming up in the future?
So as we started this, I mean, there's a priority system for testing. Priority one are you knowingly have, originally was you've traveled to an area where COVID-19 is prevalent and you're showing symptoms, you should get a test. If you were exposed to somebody who was positive to COVID-19 and you're showing symptoms, you'd get a test. And then there was a priority two, which is a little, okay, you're showing symptoms of COVID-19, but you have no other known risk, you get a test. And then tier three, which is anybody who appears to need a test and has an unexplained illness is getting there. So originally we were doing in this community only priority one because of the testing supplies and the lab capacities to do that. It took a while to ramp up and do that. And even, when we saw our first case, the first case that was reported in the Tri-Cities, I believe that the lab results from the time tested were about 10 days apart. So for us, a whole lot of people that contacted that person could have been exposed, could have been showing symptoms, and exposed a whole great number of other people before we even started investigation and contact tracing. So those things have improved. So when we talk about testing, lots of clinics, so our hospital systems, both Trios, Cadillac Regional Medical Center, Lourdes, and Prosser Memorial Health all offer testing through their health system. They have, not only their hospital facilities, but they have a number of clinics, and they do that as well. And if somebody thinks they need a COVID-19 test, they need to contact their physician. And you want to do that over the phone and set an appointment or at least get a consultation so that they know, and they will send you, if they need and want you to do that, your physician, they're going to send you to the appropriate facility to do that, because not every Cadillac clinic is doing COVID-19 testing. They will send you to a particular clinic where they've got the PPE, because one of the things that we're very concerned about is making sure that we have the appropriate and stable supply of personal protective equipment for those healthcare workers that we need. And that's generally how you would do it. When you think about I call them FQHCs, the Tri-City Community Health, Columbia Basin Health Association up in Connell, Yakima Valley Farm Workers, or Miramar Health, they all do testing as well, and they do RNA testing. So they are available as well to do that, and they work with the health department. And they are usually doing that through commercial labs. So Tri-City Lab, Quest, Interpath, a number of labs actually run those types of samples. And as over time, when TCL and their parent company, all of those tests were being run in a lab in North Carolina. They're now being run, for them, and I think it's in Phoenix now. So it's much closer for us, and the turnaround times have improved from labs. We also have the state lab, public health lab runs samples. They can't run, their capacity is limited. So when we talk about other folks like long-term care, the health district is usually supplying the testing materials through our arrangements with Department of Health and Emergency Operations, getting those supplies. And if they have, that facility has a relationship with a laboratory like Tri-City Labs, they're shipping those through those labs. If they don't have a relationship, because we do have a number of very small adult care facilities that don't have that relationship. Oftentimes, their staff will obtain the samples, and Benton-Franklin Health will ship them and run them and get them to the state lab for analysis. We can't do thousands there, but we can do some, and we support them doing that. So those are the ways that we do that, but we make sure that those vulnerable populations right there, that we're making sure that they get supplies, and working with our state system to try and help and make sure that our other partners, that are getting their supplies mostly through their labs, if they have a supply chain issue if we can support that, we do that as well. You asked the question about serology testing or antibody testing, which is what's out there in the community, and it may or may not be valuable. At this point, Jason talked about our knowledge is changing by the minute, and serology testing tells us if somebody has antibodies, but it doesn't tell us two very important things that we don't have the knowledge of yet. One, if those antibodies mean immunity. And that's very key to state, that we don't know that means you're immune. And the other thing that it doesn't tell us is it doesn't tell us that you are if you have active disease going on in your system. So it doesn't tell us whether or not you're infected to someone else. So when we get those reports, and we are getting those reports into the health department, we actually do some investigation on those as well to try to determine if they need to get another test or if they could possibly be a probable case. I have positive antibody test and I'm showing symptoms. We would be very concerned that person actually is a case and it could be actively spreading disease. So we do look at those. The hope is as we go forward and gain knowledge that those tests will become more and more valuable to us as a system, because boy, we would really love if they actually did confirm immunity, but we don't know that now, and that is a risk, and really, for the public and for all our people listening out there, if you're ill and have COVID-like symptoms, we really want you to get an RNA test and not a serology test, because we really want to know if you have active disease, and so do you.
Oh, that's great. So we're getting into our second half hour here. Maybe we'll talk a little more, kind of transition into what's coming up in the future. I think we've all, to a greater or lesser degree, seen the governor's press conferences and, what the stages of reopening that are coming up here in the future. But could you guys talk a little bit about where are we now? What are some of the key indicators that I think, from what I've seen, you guys have on your website that say, here's the indicators that the governor's office or the State Department of Health is looking at, that allows us to go to the next stage. How are we doing on some of those indicators? And then to stay on the testing subject a little bit, if we get more access to the testing kits and can do more testing, is that part of the future stages, to get us in there, and access to testing or testing kits? Is that one of the indicators we have to show to get to that next stage? I know it's a long question, but if we can kind of move into that one.
Yeah, I mean, I'll start off, Carl. I think, not to spend a whole lot of time on testing, but, I think a lot of confusion has come to the public in terms of they say, well, now we've got so many people who are diagnosed with COVID as compared to where we were, say, a month ago. Why is that? Well, that's because a lot of our testing has been increased in terms of capacity. So anytime one goes about doing more testing, well, guess what? Of course, you're going to get better numbers, whether they're positive or negative. So I think that's one thing we need to keep in mind. And until we get, in terms of kind of transitioning this discussion in terms of kind of a safe start reopening, one of those things we're going to have is clearly an abundance of available testing supplies and processing for sure. So Rick, I don't know if you want to talk about the other kind of components.
Yeah, I can talk about, the metrics, so to speak, and one of those is looking at activity. What COVID activity is going on in our community? So really the metric is, how are you doing in the last 14 days? Are you seeing the number of cases increase? Is it staying steady, or is it going down? And really what we want, the key to being successful is we want that going down. And when we get that going down, we talk about, you occasionally hear the words "are not." And really that's the reproductive rate of the illness. So, and I'm going to give a very brief explanation, and it may or may not take, but it's, if I have COVID-19, I want to infect less than one other person. So if got COVID-19, I would only want to infect Jason.
No, don't infect me. No.
But, and I certainly don't want to infect Jason and Karl, because now my infection is growing, because if Jason was infected and then infected 2 people and Karl infected 2 people and so on and so on and so on, the rate of infection grows. If we keep that infection rate, so me infecting others, to 1 or less, we're pretty flat. The rate of illness is going to stay flat. It's not going to grow. It's not going to overwhelm our health system, and we're going to recover from that. If we can get that less than 1, it's going to slowly die off and be gone from our community, or at least very, very well suppressed. Then we're going to talk about healthcare systems. So how are we doing in our healthcare system? Do we have availability of beds in our hospitals? Do we have availability of ventilators? So those things necessarily to treat the sickest folks with COVID-19, knowing that, the majority of folks with COVID-19 will not need hospitalization. But for those that do we have the capacity to do that? And are we maintaining that? And what does it look like over 14 days again? How does that projection look? And then we do look at testing. How much testing can we do? And really what we want is a positive to negative ratio, that only about 2 to 5% of the tests we run in our community are positive. And I think very early on we talked about, and it may have been before this, but currently, at least on the state system, and we don't report that locally because we're not confident in the data, that we really see some very, very weakness in the data, but about 14% of the tests taken in Benton County currently are coming back positive, and that's what's listed by the state. And in Franklin County, it's 22%. So we've got a long ways to go to get to that 2 to 5%. And a big factor of that is the amount of testing we're doing. To be able to get where we need, and with our population, we should be doing 500 to 600 tests a day, and we are not doing even 50 probably right now. But we're working on that capacity, and we'll get there. And some of the days, like when we see sudden spikes, it's because we've done more testing in those couple of days prior to that. And other things for us are, doing, and I know that this has taken a long time because it's a lot of metrics.
This is great.
One is our ability to do that case and contact investigation, which is being able to get a report and do that case and contact investigation. The case investigation within 24 hours of receiving a report, and getting all those contacts from that investigation reached within 48 hours. Currently we're doing really well at that our staff are keeping up with it. So that's a good thing. But as we open up, we might accept a little more volume of people ill because we'll be testing more. So we may have a little bit bigger hurdle to reach. And then we need to protect our high-risk populations, which, we've talked about multiple times. We're doing that, but we need to not have outbreaks going on in our long-term care facilities. And we're pretty close to that, but we need to be able to maintain it. And that means proper infection control, proper PPE, and the ability to test frequently and when necessary in those communities as well. Because I've said before, a negative test today doesn't mean a week from now I'm still going to be negative, because I could be exposed in that intervening time.
You bet. So that was a great overview, Rick. Thank you. So how are we doing? And those metrics as it applies to collectively Benton and Franklin counties getting to stage 2 and, being able to reopen some of those businesses. I think you kind of indicated it, but it sounds like we have a ways to go to get there based on those metrics. Is that kind of the overall picture where we're at?
In some of them we're doing pretty well. A couple days ago, you asked me about the trend, and it was pretty flat and was doing well, and then we get a spike in cases, and now it's going on. Over the last 14 days, it's a little up, but not much. So we're close. The hospital system is doing well. Testing is one of our big things. Being able to maintain contact tracing. Today, it's great. And that's our worry is as we open up, and we've talked a little bit about our staff, that we have staff from all over our agency whose regular jobs are not case investigation and contact tracing. And as things open up, we have lots of other mandated services that need to be done when the community's out doing things. So we will have to continue working on maintaining that capacity. And in doing that, we're working with, for those that have been on the phone with us, we're working with our partners. Some of our large employers are going to be doing contact tracing for their workforces to help with that and help make sure that we're all very quick and nimble at mitigating the spread as quickly as we can. So I think most of the things we're close, and we're taking those efforts. Testing is going to be the hard part, and it's not necessarily going to be something that we're always going to be in control of, because supply issues are nationwide, and we all keep working on them, but hopefully we'll get there, and each and every day we see improvement. So we think, by, I think it's June 2nd was on the schedule, hopefully we'll be there. And, we think that in all hopes that we'll be ready to move forward. That's the hope.
I think one other thing to add here, Carl, I mean, we've kind of beat to death the testing capacity issues and that kind of thing, and the availability of testing kits and media and so forth. But if I had to sum it up in a couple of sentences, it's our ability, obviously, to have that testing capacity there, like Rick mentioned, to be able to do that 500 to 600 in our community per day with consistency over time. That's number one. And number two is that contact tracing and case investigation, our capacity to do that. We've started working with a couple of large employers to train them in terms of what all is involved with contact tracing, so that they can go back and do that for their own employees. In some cases, when it comes to the hospitals, actually working with the patients there as well. So we would welcome the opportunity from the public if there are large employers out there who are interested in contact tracing training, in other words, a train the trainer kind of a concept. We would be happy to entertain any request for that. What that might look like, just to give the community a little bit of an insight. First of all, full disclosure, we're in the beta testing stages of that training. It will improve over time, for sure, just like most things do. And it will involve a number of training modules coming from ASTO, where individuals will sit down, review those training modules, and then those individuals will spend time with us, job shadowing, in essence, that contact tracing process until they feel like they've got it down, as well as getting familiar with some of the forms that need to be dealt with along the way, particularly for us. So that's kind of what we're looking for. And if there are employers out there who are looking for help with that, we would encourage them to reach out to us.
That's great. Thanks, Jason. Just quickly on the contact tracing, I know we've all read articles about technology that might be used, but within the current plan for contact tracing, from what I'm hearing, it sounds like it's more of a traditional contact tracing methodology that's being used locally, where it's just people that go through this process. You indicate with the training that's there, and then just a follow-up question on that, and then we'll get into reopening businesses and what are some things that resources that are out there. But on the no, I forgot it. Let's just go on to the question about technology and contact tracing.
So technology, we have piloted a few things, trying to do some electronic surveys with folks via email, and found that early on it was very unsuccessful. So we went back to the old tried and true. We use the telephone, contact people by phone. I know that there's a lot of information out there, or misinformation out there, that we're going to knock on your door, we're going to involuntarily quarantine you.
Right,
and that is far, far from the case. We are doing this by phone. We expect that the people we're talking to are responsible citizens and adults, and when we ask things to happen, they generally do happen. We say, hey, you're ill, you have a positive COVID-19 test, here's how you need to isolate yourself. to protect not only your family, but others. And then we ask that information, say, tell us who you've contacted in the 2 days, 3 days prior to you showing symptoms, so that we can talk to them as well. Because we want them to be able to be responsible and help protect their friends, their family, and their loved ones the same way. And it's not, you're going to do this, it's, we need you to do this, we want you to do this. But, frankly, we don't have time, effort, staff, or desire to be enforcing things that are, could be considered violations of rights. I mean, honestly, if I involuntary quarantine somebody, I could probably get away with it for about 2 days, and then I better be appearing before a judge to enforce that, because our powers are pretty limited in what we do, and we have no intention of spending time before a judge, because whenever I end up before a judge, the only person who makes out in that is usually the attorney, and the monies and the billings that happen, because nobody ever leaves a courtroom happy, for the most part.
You bet. Oh, that's great. So looks like we're down to about 11 minutes. So let's just jump right into realizing we're not at phase 2 yet. We do have these indicators out there that I think are on your website, so people can go and check them out on how we're doing. But once we get to some limited reopening for certain types of businesses, I wanted to point out to your website, you guys have some great resources out there for guidelines for businesses to reopen. So any businesses that are watching, I'd like to encourage you to go to the Benton-Franklin Health District website and check out those resources, which will start to get employers and businesses aware of what they're going to need to be able to do to reopen. But some of the things that have come up and some of the questions we're getting today, and you just talked about enforcement on contact tracing, Rick, but can you guys talk a little bit about how the interaction of a business being able to reopen once they're at the approved stage and meeting some of these safety standards that are on your website? And I think we've talked about it before, but just like contact tracing, the health district isn't going to enforce these things. You're going to do your normal, and maybe you could talk about like a restaurant where you're already doing inspections. How does that, differ? And as we talk about that, just quickly, when we've got some questions about, there's been a discussion about if you're in a restaurant, you have to leave your contact information if you eat in, and if you could kind of talk generally about those things together.
Well, I think I can try to do that from a food safety point of view. When we go into a restaurant, our purpose of our staff and our inspectors is food safety. So we're going to want to look at how they're preparing food, how they're maintaining proper temperatures, proper sanitation, how they're actually providing a safe meal. And that's not to be said that if I happen to be in the kitchen and all of their employees are 3 inches apart, that we might say, that's not following the guidelines and say that. But it's also not something that we're not the enforcement agency for labor and industries and workplace safety. So we're not going to do that. We would give education, and much in the current situation that we're in now, when the governor's orders came out, all of our prosecutors, law enforcement, we went on this, I call it, 3-day email string about what actions we as enforcement agencies would take. And really, it all stems to, we want to educate folks, because we don't expect that non-compliance or issues are happening because people want to be risky. It's usually from a lack of knowledge. And we've had a number of calls, and we do all of that. And I think law enforcement will tell you that they do the same thing. But our job is, in a restaurant, is food safety, and that's going to continue, because I also don't, I'm very concerned about COVID-19. I don't want to deal with a norovirus outbreak either. Yeah. Very, very clearly, I don't need a foodborne illness going along with this, because that just makes more work, and I'd have to stand up another urgency operation to deal with another outbreak, and we're pretty stretched pretty thin as it is.
One other thing I'll add here, Carl, if I could, I think there's some misinformation out there in terms of, well, these business entities are going to have to come to the health district to gain approval of their reopening plan, assuming they have one. And that is not the case. We are not approving. We're not signing with a John Hancock or anything like that. We're happy to take a quick look at whatever reopening plans they have. and provide advice or guidance. And really, when you think about this, that's really what public health is about, is educating the public to keep them safe. And that can apply whether it's a COVID-19 outbreak, that can apply whether it's business as usual at a restaurant, as Rick was mentioning. It's all of those types of things. But I just wanted to just interject there that we are not approving business plans for reopening per se. That is not our role. But we're happy to take a look at them and provide some comment and education on it.
That's great. I do want to add that, you know, from a business organization community, we've been having discussions with all the chambers locally, Visit Tri-City, some other business support organizations. And what we'd like to maybe interface with the health district is to provide some of that information and just, you know, making sure that businesses, as they create their own plan to reopen, that they've got access to your information. And ultimately, we'd really like to come up with some way, because there won't be any enforcement, that these will be guidelines that, you know, businesses need to really regulate themselves on. But, you know, come up with some ways, some education or training just for the general population to talk about, you know, really reinforcing that it's safe to go back and interface with these businesses, and even from employees too, that, you know, we want to make sure that as we return to normal, whatever that's going to look like in the future, as we hit the governor's stages and we monitor some of these metrics, that, you know, that we're restoring confidence in the general population. Because obviously for the economic side of it, you know, we want people to get back to accessing those businesses. And so we'll be working on that and being able to release more information. And we really appreciate the partnership with the health district. And I think you hit the nail on the head, Jason, that's the role that we can work on, more of that education and training and getting the right information out there. Let's hit a couple questions. We got about 5 minutes left just to make sure we cover them from the audience. As businesses reopen, as part of their plan to maybe, if they do have to work in closer proximity and PPE or personal protective equipment would be part of their prescription, would the health district be a resource, or is there any, you know, opportunity to share or buy PPE just because the shortage is so, you know, severe right now for businesses to reopen, or is that something that they'll have to address on their own?
They may have to, most likely are going to have to address on their own. I mean, there's some support and volunteer support that, you know, we've put out pleas for, currently for farm workers and for cloth masks, and have seen, you know, a pretty great response for the people out there making those. But, you know, we do some of those things, and it's when we see, you know, a specific industry that is really at risk, and trying to help them when we know that we can't necessarily acquire supplies from the state stockpile or the federal stockpile for that, and reaching to our community for that assistance. But as we go forward, we know that PPE supply chain is getting better, you know, that we're seeing that our hospitals are not struggling as much, and, you know, we're certainly not seeing the direct shipments that are coming here to Franklin County Emergency Management, you know, of the state stockpile for our local EMS and hospitals and long-term care. It's not showing up as frequently now, and that's, you know, simply because they've been able to use their regular supply chains to start getting some of those items, you know. And you know, for businesses, kind of the same way, they need to think about that and start looking today to where they can source personal protective equipment that they, you know, honestly, 8 weeks ago wouldn't have ever thought about needing. So, you know, it's going to be a little bit of a different world, and, you know, we may be able to, you know, work on some resource lists to help people find where they can go for those things. But actually acquiring them is probably out of our realm and our abilities. Yeah.
Okay. We had some questions about non-English speakers, so both on contact tracing and then on any training. Are you able to provide materials and even some of the contact tracing if you called with non-English speakers? And we also had a question there about even Russian. Are you able to access and get translation if you need help, or how's that going?
So we have a contract with a thing called Language Line. So if we have that issue, we do use that service to do translation if we have folks that need it. We do have a pretty good number of Spanish speakers. Contact tracers are actually in our employ, and in volunteers as well. And we have put out pleas for people who speak a variety of languages as well, even if it's just for translation assistance while a contact tracer is sitting there guiding them through this to ask questions. We are always looking for support. We're putting lots of materials out in Spanish. A lot of our partners, especially Seattle-King County Public Health, translates documents into multitude of languages, and we pirate those pretty regularly. So, we don't necessarily have that great ability, but some of our partners do, and we're all out there supporting each other and working forward to get things done.
That's great. Well, let's go ahead and wrap up. And we do have one more question I think you guys can address, and maybe if you want to make just a closing statement. But you talked about small businesses can contact the health district for feedback on the reopening plan. How would who'd be the right person to call, or through a website, or what can you recommend on that? And then if you both want to just give a little statement, we really, really do appreciate your time today. I think this has been a great discussion. I think it's been a really good information to share with our audience out there today.
So two ways. They can call our main number, which is 460-4200, or they could call our COVID line, which doesn't ring in my bell, but you can look at our website. It will be there, and either way, you will get a person. The 4200 number will get you a person 5 days a week. The COVID info line will actually get you somebody 7 days a week, but you have to be careful with the COVID line, because if you hit the right button, it'll send you to 211 services, which are handling, a lot of the basic COVID questions, not only for us, but across the state, so that, we can really handle the odd questions as well. And those folks will get you, contacts via email, or, even verbally go over it. We are working pretty intensely right now, and we've got some community members piloting some formats that we've done for, a COVID-19 safety plan, kind of a template for folks to think about that they can just fill in and adapt to their own particular business, so that they can have something. And that is, the big key that I see for businesses is start now, develop a plan, and even if it's not perfect, you can get to perfect based on the guidelines that keep coming out. And new guidelines for individual types of businesses are posted almost every day. And our staff, we have a staff of 4 information folks we call them the information trolls, because they're out there searching for that information and acquiring it from wherever the state of Washington is posting it, and making it available to the public as quickly as they can. So we know that it's there. The COVID-19 business guidance page is up on our website. You can expect that in the next few days you're going to see a community recovery page going up as well. I'd like to say we're working around the clock, but that's not true, because we actually are trying very desperately to respect and maintain our staff, knowing that this mission, this emergency, is not a sprint, it's a marathon, and we have to conserve our effort and make sure that we actually survive to the end, so that our staff are still well and healthy and capable of doing good work. So, in closing, I do think that we recognize that for me, and Jason will close with some other stuff, I'm sure, is the overwhelming support that we get from our community partners and our citizens is heartwarming, and it helps BFHD be successful in leading this response from a place that we're not comfortable from. We're not comfortable being in front, but we're going to stay there, and we're going to guide and assist our public and our community to recover from this.
Yeah, that's some good words there, Rick. So, Karl, I think in closing, as we begin to close out this session, first of all, thank you very much for having us. We really appreciate sharing the information with the community and everyone on the phone. I guess the summary I would like to share is that this disease, you can protect yourself from this disease as an individual, right? We know what to do now. We've known what to do. And I just would encourage the folks out there on the phone and encourage others in the community. If you're not aware of how to protect yourself, go figure out how to do it. Go look at our website, go look at the CDC, go look at the Washington State Department of Health. Give us a call if you have questions. There are many avenues to contact us. We can protect ourselves, we can protect our loved ones. If you're not sure, ask. We will continue to provide as much education as we can to the public with current information. And I think, we are all in this together, and we will get through it. There's no doubt about it. It's just, we don't want to lose any more people along the way than we have to, including all of our loved ones. So, pay attention. Give us a call if you have questions, and we're happy to work with anyone.
Well, Rick Dawson and Jason Zaccaria, sorry, I just had to physically think about how to pronounce your name, but I appreciate you giving me the heads up on how to pronounce Zaccaria. Thanks for your time this morning, and please, for your team, pass on our thanks for what you guys are doing. I think the description of your role traditionally is in the background. You guys are in the foreground and leading this effort. So anything that we can do from the general community, please reach out, and we really appreciate your partnership. So thanks for your time this morning. For the general audience, thanks for joining us. And next week, we're going to have Chris Johnson from Association of Washington Businesses on with Coffee with Karl. So everybody have a great Friday and a great weekend. Thank you.
Thank you. Take care.